Hello, everyone, and welcome to this week's webinar. I'm Loretta Maddox, and I am an account executive and compliance specialist here at Healthcare Compliance Pros. I have with me today, as usual, Chad Schiffman. He is our Director of Compliance, and I have Nicole Mark, who is our Marketing Manager, and she is going to be moderating our poll questions as well as assisting with any questions that you guys have as we go through the presentation. So we are still in our COVID-19 response and recovery series. Today we are going to be talking about telehealth and remote workers. Chad is going to be guiding you through all the information that you need to know on the telehealth side, and then I'm going to be wrapping up with remote workers. As always, as we go through this information, please submit your questions. If you've got something on your mind that you would like to discuss, please submit that in the questions box, and Nicole will give those to us at the end of the program. Also, if it's something that's not related specifically to the content, please feel free to go ahead and ask those questions as well. We want this time together to be as beneficial to you as possible. As we always do, we want to just remind you about our COVID-19 toolkit. This toolkit is continuously updated anytime we find something else that we think is going to be relevant to our clients. We want to put this information in the toolkit. If you have questions about how to access the toolkit, please contact your compliance advisor and we'll get that set up for you. So I am going to go ahead and turn things over to Chad now so he can share with us some information on telehealth. Chad?
Great, thanks, Loretta. So yeah, we thought it would be good to touch base on telehealth, talk about some of the considerations for using it, some of the history of using it, and also, how it's changed and how we expect it to continue to be used going forward post-COVID-19. First things first, we kind of wanted to talk about a little bit of the differences between telehealth and telemedicine. Now, in much of the healthcare industry, the terms telehealth and telemedicine are used interchangeably. In fact, even the ATA considers them to be interchangeable terms. Now, it's not surprising since telehealth and telemedicine definitions encompass very different services. For example, medical education, e-health patient monitoring, patient consultation, all via video conferencing, health wireless applications, transmission of imaging reports, and many more things that telehealth is being used for. But if you want to get technical, what we wanted to talk about is telemedicine is actually a subset of telehealth, whereas telehealth is more the broad term that encompasses all health services being provided by telecommunications technology. We just wanted to share that information because we get, we see a lot of guidance come out that specifically talks about telehealth and uses telemedicine. We just thought it would be good to kind of go over that at the beginning. So on our next slide, we'll talk a little bit about the telemedicine and a quote that Dr. Yuan Wang once said. This was a couple of years back, really, when he was doing a presentation. Had he known what was in store for 2020, he would have seemed incredibly sharp, because he said that telemedicine will become the core methodology of healthcare delivery in the future. That is where we are going to be, or get the efficiencies we need to provide affordable care, and that has proven true with COVID-19. Next slide, please. In fact, according to a recent survey, 73% of people who responded to the survey, there were about, I want to say there were about 4,000 people that responded to the survey. 73% said that they would consider using a telehealth service to be screened for COVID-19. Not surprising with some of the concerns, regarding COVID-19 and how contagious it is and all of that. Now, more than 1 in 10 respondents said they've already used telehealth services for something related to COVID-19. Now, before this, the numbers were interesting in that very few, in fact, it was 33% said that they were comfortable considering telehealth in the future. Now, it was an upswing at that point, but it's kind of interesting to see how COVID-19 has impacted this. So as you can see, 60% said COVID-19 pandemic increased their willingness to try it. Now, previously, as I mentioned just a second ago, 33% said that they would have only been willing to do it. So that's a pretty significant jump in numbers. Next slide. We believe that telehealth and remote monitoring are here to stay, and so do other health systems and professionals throughout the country. Health systems across the country rapidly stood up for and implemented virtual care programs to monitor COVID-19 patients. In fact, that was one of the safest ways they found to do it. Now, these programs have proved crucial during the pandemic. Many organizations were able to see, and perhaps your organization is one of those, actually be able to see their patients remotely and still continue to provide care for them, even though, they didn't have their, there were very few visits, for the essential visits that were happening. And so some of these non-essential visits were able to happen that way. Now, as the country begins to emerge from the COVID-19 pandemic, these virtual visits, telehealth, remote monitoring, and wearables, huge industry right now, we expect that they will continue to be a way of life in healthcare. In fact, we expect that there will be an upward ticking or trend in adoption of this technology, and many health experts agree with that as well. In fact, prior to COVID-19, we were seeing an upswing in that, an upswing in telehealth adoption, remote monitoring, wearables. It's a big industry. In fact, I'm wearing one right now that tracks all of my activities, and so that's just what we're going to see in the future. Next slide. But like anything, telehealth, there are some bad actors out there. So this is a reminder to be aware of those. In fact, numerous reports indicate that telehealth adoption, as we mentioned, was trending, but cybersecurity experts were concerned about potential privacy security risks even prior to COVID-19. Now, during the pandemic, even with enforcement discretion in place, healthcare organizations and cyber professionals have had to be aware of these bad actors. There have been different scams going on with people trying to obtain information via email or calling people, even patients, and saying, hey, we're providing telehealth in an attempt to get their financial information, or even vendors that have reached out to companies to say, we are offering a platform that really wasn't a telehealth platform. It was more of a method to obtain company data. So, and one of the reasons why all these types of threats and things were happening and these bad actors were trying to capitalize on it was due to the immediate need of telehealth visits. That was the one way that patients were able to be seen quickly, and knew that there would be adequate safeguards in place, assuming they were using a platform that was either approved by OCR or a HIPAA compliant platform. And so because of that need, there were a lot of these bad actors that thought, okay, well, let's see how we can pounce on that, take advantage of some unsuspecting patients, some organizations, all those types of things. So next slide. So we put this slide together for safe telehealth practices. OCR actually said that they expect providers will ordinarily conduct telehealth in private settings. That's what we've seen so far. You're not going to see people conducting telehealth services in a coffee shop, or at least we shouldn't. But the clinic should be doing it, if at home in a private setting, to where it's free from distractions, no one's overlooking or overhearing their conversations. Providers should use private locations, and patients should not receive telehealth services in public. We talked a little bit about that, no coffee shops or semi-public settings, absent patient consent or other circumstances. So you definitely want to be very cognizant of your background when doing telehealth. Now, if it can't be provided in a private setting, providers should continue to implement reasonable HIPAA safeguards to limit those incidental uses and disclosures, just like as if you were in your office and you were closing the door when you're with a patient. Those types of safeguards, even done remotely, need to be in place. And that includes having the timeouts on your screen, not leaving your data up, because you just never know who could be looking. Now, if you have a locked office and other safeguards in place, different reasonable safeguards. And other precautions such as lowered voices. We have our kids at home right now with us, and having to teach them at home. So we had to learn how to use lowered voices or have them go in other rooms and things while we were on calls. And even though that we don't directly deal with PHI in our role, we're giving some support to clients to where there's some conversations happening that I don't think others need to be hearing, so we try to keep them confidential. Same is true with telehealth. You want to make sure that you are in a place where it's comfort, and also advise your patient of the same thing. You know, when you're doing your telehealth visits, the thing is you can tell your patients, hey, we're going to be discussing some sensitive information. If you're not comfortable with anybody and being in the room, we suggest that you know, are in there by yourself, and do that type of thing. Next slide.
Hey, Chad, I wanted to make a point to that when you mentioned, you know, instructing patients. Also, I think that's a very good point, because we have to keep in mind, we talked about this a little last week in our lessons learned. You know, one of the practices that we talked to said that their patients really didn't understand how to do it. So I think that is a very good point to help the patients realize, okay, you need to be in a private spot. There's a lot of sensitive information. So that's a great point, Chad.
Yeah, for sure. And you know, they should understand too that anything that is being said, you know, a lot of people will put things on speaker phones or you know, have them use their computer and not have a headset, for example. You know, they might be on a laptop and just let it be on the speaker. So all those considerations are important too for your patients. Now, as far as there are really, at the end of the day, there are three main security safeguards with telehealth. Three main ones that are included in the security rule. The first one is must ensure only authorized users have access to ePHI. Like anything in healthcare, that's extremely important. It's like your EMRs, anything like that. You want to make sure that only authorized users are getting that information. Second, you should have a system of secure communication that should be implemented to protect the integrity of ePHI. Now, as we've talked about in previous webinars, during the COVID-19 pandemic, there is that enforcement discretion. However, we still recommend using a secure communication platform whenever possible. We have a whole list of them. If you need help implementing one and you haven't done so already, please let us know and we'll help you with that. Third, a system of monitoring communications containing ePHI should be implemented to prevent accidental or malicious breaches. And that's the same with anything, you know. For example, email. If you're sending an email to a patient, there's different safeguards that you should have in place if you're using PHI, you know, no PHI in the subject line, right? So same thing with communications with telehealth. You want to follow those types of safeguards. Next slide. So we do have a poll question, Nicole. Were you going to ask that for us?
Sure am. Here you are.
So our question is your telehealth platform vendor HIPAA compliant, and do you have a business associate agreement in place with them? So, you know, as we've talked about, you know, with the enforcement discretion there, it's Skype and different platforms that you are able to use, FaceTime, different things that you can use with your patients. But we're curious to see how many have gone ahead and used a HIPAA compliance.
Here you are.
6% now, 38, okay, don't know. Yeah, so we would just be cross-referencing, I guess, against the compliant one platforms to see, but 56% is pretty standard. That's what we would have expected to see on that poll. And so platforms that were identified in the OCR guidance were specifically Skype for Business and Microsoft Teams. UpDocs and Zoom for healthcare. That's one that we've seen a lot of traction. Even though Zoom's come under fire for certain things that have happened with attacks, they've addressed those. But Zoom for healthcare is a HIPAA compliant platform. Doxy.me, Google G Suite, Hangouts Meet. We've heard a lot of clients actually reporting that they're using that and taking advantage of that. That was an easy one for them to use. Cisco WebEx meetings, WebEx Teams, Amazon Chime, and GoToMeeting are some other examples.
All right. Well, thank you, Chad, for that information. We're going to shift gears, not a huge amount, because there's a lot of information that is going to be applicable for remote workers that was very similar to telehealth when it relates to the technology that we're using. Before we do switch gears, though, back to the the platforms that are being used for telehealth, and based on that survey, you know, there's a significant amount of you that are not sure if your vendor is HIPAA compliant and that you have a business associate agreement in place. And so our recommendation right now is, yes, we are still under enforcement discretion, so that's not a HIPAA violation now, but as soon as we come out from under that, if you are using these platforms and you don't have that business associate agreement in place, that is a violation of privacy and security rules. So we've got to make sure that during this time we start getting answers to those questions, because we want to make sure that you guys are compliant. So now we're going to talk oh, I'm sorry, Chad, go ahead.
Oh, I was just going to say to that end, we have actually been really impressed with the responses and feedback we're hearing from our clients. You know, an overall commitment to compliance, really, you know, a culture of compliance within their organization that has been amazing to watch throughout this COVID-19 thing. So we just want to say good job to all the clients who have been doing that. We're really impressed.
Absolutely. All right, so for remote workers, when we talk about using remote workers in your organization, I mean, there's still several factors that are pushing us toward staying in that mode. It is still encouraged when feasible as we are going through the reopening phases. If there is a job that you can allow someone to do remotely, as we reopen, that is something that is strongly encouraged, and it may be strongly encouraged for a while. So there's that. Then there's also, with our employees that are most vulnerable, there is also there's some information that will lead us to thinking that, okay, this may be one of those reasonable accommodations. If you have an employee that identifies themselves to you as a high-risk employee and they're afraid of coming back to work, if there is a reasonable accommodation for their role as a remote worker, then that's another time that you may be using remote workers that you weren't using in the past. And then it's also useful if you have someone on your workforce that has been exposed but isn't displaying any symptoms. You might, during that time when they are not coming back to work, you know, for that 14-day period, they may still be able to be productive if you have the option for them to work remotely. Now, that's not going to be super helpful in direct one-on-one patient care, but it may be helpful in other ways. And if you can keep those employees productive, that's going to be much better for you because you're paying them anyway. So we want to make sure that you have those options. And then, as you've heard from Chad, telehealth is remote work also. I mean, if you think about it, now, not always, but during this situation, you've got your healthcare providers that are providing telehealth services, and they're at home. They, as Chad mentioned, we've all got our children home with us and other people, you know, around in our homes. So we can't, I don't want us to look at the enforcement discretion for telehealth as just a kind of get out of jail free card. There are still things that we're going to have to consider as a remote worker, even when we're providing those telehealth services. So I want to start out now with a couple of poll questions. So Nicole's going to put that up for you. Are you using remote workers? And I'll give you guys a second to answer that. And I really kind of expect this to be a large percentage of our attendees.
I would too.
All right.
Yeah. Wow.
Okay. Yeah. Wow is right. That is a large percentage of you that are using remote workers. So clearly, this is something you're already doing. And now let's, as we move forward, we're going to give you some tips on how to make sure that you're protecting that information that they're working remotely with. We have actually a couple more questions. Our next poll question is, are you allowing workers to use their own device, or are you issuing one from your organization? So this would be, are you allowing your employees to be at home and just log in through the VPN to your EHR with their personal device, or are you actually sending them home with a laptop that you are managing in your organization? And I'm super curious about this one.
Me too, just with the recent adoption and bring your own device. Oh, there we go.
Right. Okay, I am impressed with this, actually. I was expecting there to be more personal devices being used. So, okay. All right. So moving on to our last question. Have you included remote work in your security risk assessment? And I know you guys are probably tired of hearing Chad and I say security risk assessment, but we love this stuff, so you're probably going to continue to hear us talk about it.
Well, and then, you know, and the importance of a security risk assessment, you know, as we've seen with recent statements from OCR, just the importance of it and as a enforcement actions. And
right. And to that point, okay, here we go. So his numbers are super small for me. We've got, is it roughly 50%? Yes. And then
Yes, 50%.
Okay. Okay. So we basically half is no or unsure. So that's split right down the middle. So I do want to take a second and talk about those responsibilities as they relate to HIPAA. HIPAA rules in general are continued to be enforceable for remote workers. I know we have enforcement discretion for telehealth, but remote workers have been a thing prior to COVID-19. And as you all know, you've heard us say it before, any electronic protected health information that you are accessing, creating, transmitting, or storing, you have to assess the risk to that data. And so when you have remote workers, you have a variety of those things that are happening. So your responsibilities as a covered entity or as a business associate is that you do assess the risk for remote workers, and you've got to look at any potential risks and vulnerabilities, and then as a part of your risk management process, you have to put things in place to mitigate those potential risks and vulnerabilities. And you do that through having written policies and procedures that go through and address your administrative, physical, and technical safeguards. Chad mentioned three very important ones when he was talking about telehealth, and the same applies for remote workers. You've got to make sure that the right people are having access. You've got to make sure that you're protecting the information in transit. You have these responsibilities, because even though we do have that enforcement discretion for telehealth, if we have a situation that arises due to a remote worker and there's a breach of patient information, especially a breach that impacts more than 500 of your patients, then now we're going to be audited, and it's going to be looked at, were you following the security rule? And granted, I do believe, and this is based on the OCR call a few weeks back, they are going to take the whole COVID-19 situation into consideration, but they're also going to look at systemic non-compliance. And if you have other areas that are not in compliance, and you have a situation like this happen even right now or shortly after, those things are going to be taken into consideration as well. So we really want to make sure that whatever you're doing, that we're doing it in a HIPAA compliant fashion. And then finally, making sure that remote workers, all of your workforce, are getting that ongoing security awareness training. And of course, any training on new policies that you implement in order to have your folks working from remotely. So this just came out yesterday, and this is from Cybersecurity and Infrastructure Security Agency, or CISA. And this is from the U.S. Department of Homeland Security. They have issued an alert identifying the top cybersecurity vulnerabilities that have been routinely exploited by foreign malicious actors. And so I wanted to talk about these three. And this does get super technical and way over my head quickly, so I'm going to keep this as brief as possible. Chad may have to help me out if I get off track. But basically the things that popped out of this report are that these bad guys are looking for unattached virtual private networks. Now, if you ask me what that means, I could not explain that to you, but I know it's important. And so if you are allowing your remote workers to access through a VPN, then whoever is managing your IT, you need to make sure that that VPN is up to date, that the patches are being done appropriately, and that is not an area where someone that shouldn't get in can get in. Chad, did I do an okay job talking about that, or do you want to make it sound better?
That was great. You did a great job.
Okay. All right, good. The next thing that has been an issue is that they have been targeting organizations who have quickly tried to deploy Microsoft Office 365, and because we're trying to get in this remote process, and so in doing so, if the security configurations were not done appropriately, then that leaves another area that's open and vulnerable to attack. So you've got to make sure that, I think it's a matter of, if you're not the expert on this, you need to be connected to who is, and to help you determine, okay, when we put these new methods, we deploy these new methods, we need to make sure that everything that's running in the background is secure. The last thing, cybersecurity weaknesses, and this is going back to that ongoing security training. Poor employee education and social engineering attacks have continued to make organizations vulnerable. And also the lack of system recovery and contingency plans. And I feel like we could do a whole series on this, and Chad and I have talked about it, but there is, and you guys may even look into your own organization, and especially right now, do you have system recovery and contingency plans? Are they, and we're not talking about just a checklist, we're talking about what are you going to do if your system goes down, if it's hacked, if there's a ransomware attack, how are you going to get that data back up and running? And they're saying that this is a big weakness, because if your information is locked down from a ransomware attack and you don't have a contingency plan in place, that's going to cripple your organization. So now is the time to really look at these and make sure that we have things in place that not only are you required to have in place by the security rule, but you need to have in place just for, number one, patient care, and then making sure that you can continue to practice. So I want to briefly touch on the security risk analysis. I'm not going to go too deep into this again. This is a topic that we could spend a whole series discussing, but I just want to remind you what it is. It is an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of all electronic protected health information. So that's that key piece. If there was a ransomware attack or a malware attack and you couldn't have access to your data, that's a problem from a security rule standpoint, because now all of a sudden your data is not available. So it's not just if somebody views it, but if you don't have it anymore, if your system crashes and you don't have a good backup, those are all issues that you have to look at when you're doing this security risk analysis. And then any system or device that is used to create, store, transmit, or receive protected health information must be included in that risk analysis. So I was really glad to see that many of you that are allowing remote workers, you are issuing them an organization device. And what I would assume, and I hope I'm right on this assumption, is that you have deployed the same type of security methods on that device as you would on the devices that are used within your practice. That's important, and that's a really good step. For those of you who are allowing your remote workers to use their own personal device, this is something you really need to think about, because you're not you don't know what is going on their system, what, if their system's up to date, if they have adequate malware detection, antivirus protection, those types of things. So this is another important step. If you're allowing individuals to use their own device, it still needs to be included in that security risk analysis. So some considerations for your remote workers. I think it's very important to have specific job descriptions. Now I'm gonna step away from the HIPAA aspect for just a second and talk about just day-to-day functions. If you've got individuals that have been used to coming to the office every day from 8 to 5, and now they're in a remote situation at home, and their kids are at home, and their spouses are at home, and there's a lot of stuff going on, things are going to look different. Their day may not be an 8 to 5 day, or if it absolutely has to be an 8 to 5 day, that really needs to be outlined for them, because this is a new world. And for some of these individuals, some of us have been working from, remotely for a while, but when it's new, I think it's important to have it specifically outlined. What work needs to be done? What are the accessibility expectations? And what I mean by that is, when do you want that worker to be accessible? Do they need to be accessible 8 to 5 by phone? Do they need to be signed on and working at certain hours? Or is their work something that could be done after 5? So those are considerations that need to be looked into and then discussed with the worker and make sure that everyone is on the same page. And that leads, same thing with the hours worked. I've worked remotely for a lot of years, and sometimes it's hard for me to stop when my office is in my home. So I think these things are things that are good to be outlined for your workers that are going home and taking this stuff remotely. The technology. Again, are you going to be issuing them a device, or are they going to use their personal device? If they're going to use their personal device, there are certain things that need to be in place to make sure that device is just as good as the device that is in your practice from a security standpoint. And then whose responsibilities are those? Are you going to put it on the employee to make sure that everything is up to date, or are you going to pull that in to your IT department? Personally, I would recommend that if you're going to be on the hook for a problem, I would want to be in control of that. So I would probably lean to the side of making sure that however you're managing your IT in-house, it's also managed on these remote devices. And then connectivity. Do they have good connectivity from where they are? Do they have high-speed internet access? I know that may sound a little silly, but that is something that, depending on where they're going to be working remotely, that may be an issue. And that leads us right into the cost. If you are going to require them to have a higher speed access, who's paying for that? Is the company paying for that? Is the employee paying for that? And those things need to be discussed up front and determined so that there's no confusion there. And then also, just remote workers, they're probably going to be using their cell phones some too. So should you consider any type, and I'm not saying that these costs are required, please, but I'm saying there are things to consider. So if an employee is having to use their cell phone, they're having to pay more for the internet, are those things that the organization wants to reimburse or to handle for those employees? And then physical security. We've talked a lot about technology, but physical security is still a big deal. Depending on where that individual is working remotely, if it's in their home, if it's in the, if it's at the kitchen table, if it is in a private office, these are things you need to know, and these are questions you need to ask. Where are you going to be accessing our protected health information? Are you going to have paper? Are there going to be USB drives that have data on them that are now going to get, lost and thrown in the trash accidentally when the table was cleaned for dinner? So these are very real things that you need to consider, and there is still the obligation of making sure that unauthorized individuals do not have access to protected health information. This means that that employee needs to make sure that nothing they have related to patient information is accessible by the kiddos or by the spouse or by anybody that may drop by for coffee. So we really want to make sure that that's addressed as well. And then Finally, just some other risk management strategies that I think are important, and Chad and I have talked about a little of these today as well as other presentations. We've got to make sure that our people are trained, because you can have the best policies in the world, but if nobody's following them because they don't understand them, that's not going to help you too much. So we want to make sure that everyone is trained appropriately and that we do have documentation in writing. Also, make sure to execute any data use agreements, confidentiality agreements, if they're bringing their own device, those types of agreements. And we do have sample agreements that are available to you. Many of you have probably already used some of those, so I definitely encourage you to do that. And then I talked about ongoing security awareness training, and ongoing is really, you know, depending on the size of your organization and the number of people that you have, you can use your discretion on that, but I think it's a good idea to regularly be providing your workforce, and this is everybody, on updates regarding malware. Does your staff even know what malware is and what does it mean? So we need to be educating them on that. Phishing attempts. In my training that I've done, I've realized that a lot of people don't understand what that means either. So we've got to make sure that everyone understands what that is and how to avoid those types of attempts. Passwords. It's important that people have good, strong passwords that, you know, definitely more than 4 digits, probably more than 6 digits, and having, you know, a combination of characters, because it is, you know, if we have the simple passwords that are out there, you know, those are easy enough to crack, and then now we have a situation where protected health information has been compromised. Also, I know this sounds silly, but make sure that people aren't putting their passwords on the device, because I still see that happening, and that should not be. Removable media. I talked about USB devices or any type of media that can be removed that contains patient information. We need to be providing training on how that has to be protected, because I don't know about you, but I have a little drawer that has a ton of USB devices in it, and they contain a lot. I mean, I don't have any protected health information on them, but those things are easy to lose. And if they're not encrypted or there's not some sort of security in place, that could be an over 500 breach in an instant. And then clean desk policy. And so what I mean by that is not just clean physically, but a clean desk policy is making sure that your staff understands the importance of security hygiene, for lack of a better term. So that means anything that could lead to a breach of information, such as, you know, obviously leaving printed out information laying around, or, you know, having passwords that are easy to see that are out, or not closing their computers down if they are working at the kitchen table and they need to, which I would not recommend, but if that's where they're at, you know, we want to make sure that if they're stepping away, that they're not leaving patient information up, that we are closing things down, even if it's just for a few minutes. We want to reiterate that it's just like when you're in the clinic. If you're walking away, you need to be logging off. And so with that, we are moving on to our updates for this week. So a couple of things that we wanted to mention from a regulatory standpoint. The OCR did issue a bulletin, and this is just a reminder. I know many of you are already aware of this, but Chad and I saw this, and there's a lot of information in this that I would recommend that you guys go back and take a look at. I have put the link at the bottom of the slide, but this bulletin is basically reminding healthcare providers that you have to take those reasonable steps to provide meaningful access to individuals with limited English proficiency. And so reasonable steps have been defined as written translations of documents or oral language assistance. But when you look at this, the information on this bulletin, there are other suggestions, and granted, these are not requirements, but these are suggestions. And some of the things, I want to go read a couple of these to you. One of them is to offer services in multiple languages and provide notices of such language access services online and advertisements and at points of service. And this is, if you guys remember, Section 1557 was where we had to make sure that we're posting in other languages information for our patients who are limited English proficiency. Also, another recommendation was designating a person on every shift to be responsible for ensuring and coordinating the delivery of language access for patients from all the way from the front to the back. And so I know many of you have already dealt with this in your practices, but the OCR tends to do reminders when they're starting to see some non-compliance, and usually after a reminder comes some sort of enforcement. So it's really just a good time to not forget about our patients with limited English proficiency. All right, and then finally, this is just a little bit of information on telephone evaluation and management visits. So CMS did, this was in the MLN that came out on Friday, I believe. So the interim final rule that came out on March 30th did add coverage during this particular public health emergency for audio-only telephone E&M visits. And you see the codes on your screen, and these would go retroactive to March 1st. On April 30th, there was a new fee schedule implemented that increased payment for these codes, and the MACs are going to be reprocessing these claims that either they previously denied or if they paid at a lower rate. There is nothing that you have to do. This is going to be done automatically, but we just wanted to make you aware of this, and also that there are a number of add-on services and that Medicare may have denied previously, and those are going to be reprocessed for claims with dates of service after March 1st. So we just wanted to make you guys aware of that. So as we move forward, we feel like, our weekly webinars have been really good. For those of you, our feedback has been good. We've tried to be out there to help you all through this situation. Now we feel like some of the mandates, some of the regulatory guidance that's been issued is slowing down a bit. So we will not be having a webinar next Tuesday. We want everybody to enjoy their Memorial Day holiday. So we are going to do, we're going to start a new bi-monthly webinar that will start on June 2nd, same time. You will be getting a new link for this. We are going to be looking at a number of different topics. Many of them may coincide with what we've talked about because as you know and you've heard from Chad and I, there are lots of opportunities to continue to get compliant in your organization. So we're going to look at the hot topics as well as if breaking news comes out, if there's something that we feel like you need to know or you need help to figure out, we will put those topics together as well. Chad, did you want to add anything, or Nicole?
Yes, I have a couple of questions for you guys, actually, if you've got a moment.
Oh, sure.
Okay. So what if your remote workers do not need to use the VPN to work, as our EMR is cloud-based?
And Chad, you may be a better one to answer this. I have an opinion, but yours is probably better on this one.
I guess my one question is, so if they are doing that, are they using their own home device for that, or are they using a company issued device would be my first question. And second of all, so I don't know if they're still available to respond to that question, if they're still on with us, but that'd be a question that I do have. But really, it goes about that strong username and password. And then once they launch into that EMR, and even though it's cloud-based, what safeguard is in place from that EMR at that point to ensure that really what they're accessing is contained right within that cloud-based access? So in other words, they shouldn't be able to download any of that EPHI, and they should still have the same physical security requirements in place, and also make sure that their computer is safeguarded properly. Because if they're working from home and their computer may not have the proper patches in place, like we've talked about a little bit, or proper, antivirus software in place, there could be some potential risks there, depending on what the cloud-based DMR has in place to prevent that type of thing. So that'd be the only considerations that I'd have. But otherwise, yeah, it's just, you know, once again about their access and stuff. So, and with the
Right.
enforcement question right now, you know, that they're probably, it's okay, but you just definitely want to make sure that you're looking at it. Maybe you can have one of the IT guys telnet in if they're, or, you know, I used an old school term there, but basically do remote access to their, I mean, use that term better, into their computer and take a look at their configuration and make sure that everything looks okay. That might be a good way to go about it. And that, you know, if they're using their own device, just to be sure.
Okay. And then the next one here, how do you handle LEP patients in a telehealth environment, or is it possible?
Well, that's a good question. So yes, I believe it is possible, and I'm going to go back a couple of slides because I think it might have there may have been some information in that guidance. Sorry about that. So, well, it's not on the screen. So there are interpreters that you can have remote as well. So that is one option, and I would look into doing that. And that's, I mean, it's similar to having an interpreter come in on site, but you can do that through video remote interpreting. There are certain requirements for connectivity, because if there's a delay, then that can be a problem if the internet speed is not high enough. But there are services out there that do provide that video remote interpreting, but it may be a matter of trying to figure out how to make that conference together. I mean, it could be if you're using Zoom for telehealth or any of the other platforms. I know there are ways to add people to that private conversation. So I would recommend going that route. And I would, if you have difficulty finding video remote interpreting services, let us know and we can do a little research on that as well.
And then I'd also just add one thought in that, you know, the guidance that OCR's issued with, you know, one of those last case scenario, you know, worst case scenario type things, if you're not able to get an interpreter, and let's say that the patient that you're helping has authorized an individual, you know, to be there with them and to provide, you know, interpreting services. Let's say it's a qualified family member. And those are few and far between, remember, but let's say that, and under certain circumstances, but let's say that there is one that is there. That's something that you could look into as well. And that could be another way that you could address that, but it, you know, very limited at that point, you know.
Right.
So just wanted to add that.
Great, that's your last one.
To add to that, to Chad's point on the qualified family member, just keep in mind, unless it's an emergency situation, it can't be a minor. That was something that was specifically discussed.
Absolutely. Good catch.
All right. And so were there any other questions, Nicole?
Oh, nope, that was the last one.
All right. Well, if you do have any other questions, you can send them to us at support@hcp.md, or you can give us a call. Thank you, as always, for joining us today. We hope it was helpful, and we hope everyone enjoys their Memorial Day weekend. Take care.